For joining us for Crampton News at 5 tonight, I'm Mark Hanrahan.
And I'm Tom Sherry. Whitney's on assignment today. Hospitals across Idaho are overwhelmed with COVID patients amid this crisis standards of care, and resources are being rationed. And some patients aren't not getting the care they need.
That's exactly what one Idaho woman has experienced. Andrew Bartline brings us her story that is something others are certain to be faced with in the near future.
First, my doctor's office.
Chelsea Titus has been diagnosed with endometriosis and needs a surgery to remove one of her ovaries.
And it's extremely painful, and especially when you have a flare, and I'm having a flare right now.
She needed a CAT scan to confirm the cause of her pain, but local Idaho hospitals have their hands tied amid crisis standards of care.
Last weekend, I was on the phone quite a few times with on-call doctors trying to manage my pain and my nausea, and they just kept saying, if we weren't in crisis standards of care, we would have you come in. But there's nothing that the hospitals will be able to do for you.
Under crisis standards of care, the Idaho Department of Health and Welfare says your ability to receive care in a hospital will likely be affected. Surgeries are being postponed. Emergency departments are full. Because of this reality, Chelsea's doctor directed her toward Palo Alto, California. That's where she is now.
The guy at the hospital who was transporting me for my CT scan was stopping people in the hallway to say, "You'll never believe this. This person had to fly here from Idaho because she couldn't get care in their hospitals."
Chelsea got the CAT scan and is scheduled to get her surgery Wednesday just south of Palo Alto at El Camino Hospital.
And then I think about the people in Idaho that can't come to California. They can't come to wherever to get surgery, and they're just at home suffering. It breaks my heart and makes me so sad, and I feel like it was so avoidable.
The Bay Area has some of the highest vaccination rates in California, and where Chelsea is in Santa Clara County, the county public health department says more than 83% of the eligible population are fully vaccinated.
It was me and one other person the entire time I was at urgent care, because they just are not in crisis here. They're basically having normal life out here, whereas at home, I can't get care that I need.
And that's leaving Chelsea frustrated with what's happening back home in the Gem State.
If Idaho were not in crisis standards of care, I would be at home with my family and I would be recovering right now. And I wouldn't be in massive amounts of pain away from home waiting for a surgery.
That was Andrew Bartline reporting.